Hey, welcome to This Week in Pharmacy. I'm your host, Todd Urey, founder of the Pharmacy Podcast Network. How's your week been? Mine has been fire, as the kids say. The kids say fire anymore? I'm starting to get some of this new. The newest term from my daughter is preppy. And it goes something like this. That girl, directly, because I remember the term preppy, it'll be like, that girl's preppy, or that's so preppy. And it literally means what we remember as preppy, right? But you could say that's preppy and be sarcastic. So you have to look at facial expressions and the new terminology and everything that's going with that. If you're listening to this podcast and you're feeling old like me, yeah. So if you have kids that have terminology, reach out to us on social media and share something with us. But preppy. So that is so preppy. This podcast episode of This Week in Pharmacy is definitely preppy. Hey, I want to make an announcement and something I'm very proud of. Been podcasting for 15 years. And you can imagine trying to get a podcast publication off the ground, how hard that is. And then to be able to monetize and build a business around it in order to support the voice of our pharmacists and our pharmacy technicians. And when you partner with the American Pharmacists Association in our profession, some people say that's the ring to rule them all in all the associations. And when you have people like Michael Hogue and Teresa Toll and the board of pharmacy really concentrating on what's best for the profession. How do we continue to advocate, but how do we take things up a level? And when your podcast logo is now embedded into the podcast stations for all things APHA podcast, that is a proud moment. So I just want to give a shout out to the team at APHA and how much we're 100% supporting you in advancing the role of our pharmacists, provider status, PBM reform, so many things happening in our profession. But just a shout out to our listeners. Thank you so much for listening. Thank you for listening to the APHA's podcast as well as the Pharmacy Podcast Network. I'm going to jump right into some news and we're going to get this episode started. All right. Right out of the gate from Pharmacy News, pharmacist.com/pharmacy news. Newer antibiotics seem to have slower uptake, a study says. And as clinicians continue to treat resistance gram-negative infections with older generic antibiotics that are considered to be less effective and less safe, even though the FDA has approved 7 next-generation gram-negative antibiotics between 2014 and 2019. The researchers at the NIH evaluated use patterns of recently approved gram-negative antibiotics and factors affecting clinicians' preference for newer drugs over traditional generic agents. After evaluating data from 619 U.S. hospitals, they found that 0.7% of gram-negative infection-related hospitalizations were difficult to treat resistance infections, and 41.5% of those infections were treated exclusively with older agents. This included reserve antibiotics such as polymyxins, no-glucosidides. My goodness, I am not a pharmacist and can't pronounce this stuff. And nearly 80% of the episodes, according to the finding, which were published in the Annals of Internal Medicine. So note that the newer antibiotics have a slower uptake, as the study says. Next, government releases a paper on selected states and regulation of PBMs. This is important. This affects provider status. This affects how pharmacists are paid. This affects pharmacy deserts being slowed down and or stopped because of the independent community pharmacies that are out there working for their community and needing to get paid in order to keep the lights on. States have adopted their own laws to regulate PBMs according to the new report from the U.S. Government Accountability Office, known as the GAO. And the report focused on 5 states: Arkansas, California, Louisiana, Maine, and New York. Each of these states has enacted a broad range of legislation regarding PBMs serving private health plans, and the GAO reviewed the laws and interviewed state regulators, state pharmacy associations, state health plan associations, and national organizations representing the interest of various stakeholders. I want to shout out to our listeners right now. Take a look at this news. This was published on Friday, the 19th of April. And I want you to think about who you know in your state, in your local government, in your state government, who you can make comment and use this link, send to them, send to your state representatives, and let them know that you are a resource for questions. And you could literally get your pharmacy, whether it's long-term care or a community pharmacy or a specialty pharmacy, in the news, because these organizations at a local level want to be able to have trusted resources, people that know what they're talking about. If you don't know what you're talking about, please reach out to the APHA and ask for their advisement in talking with your state officials. But this is an opportunity to bring in state officials, our state representatives, your state senators, your mayor, local people, your local county commissioners, and really dig into how you, as a pharmacist, as a community pharmacist, and as a long-term care specialty pharmacist, are working to better public health. All right. We are continuing to work on content and preparation for the Assembia 2024 event. Access 24 is coming up very soon, April 28th through May 2nd. We're so excited about this event. We are excited to be partnering with Lumicera Health, which helps to find payment for complex medication regimens and treatments in specialty pharmacy. We are partnering with RX Preferred, which is a PBM that partners with independent community pharmacies throughout the nation, as well as small employers that are ready to carve out benefits and really take control of PBM spending. They're the anti-PBM, literally. They're just a wonderful organization. A shout out to RX Preferred in what they're doing. And Assessia Health, we're going to have interviews with Assessia Health. You probably hear some commercials on some of our podcasts that are supporting Assessia Health. Take a look. Assessia Health, RX Preferred, and Lumicera Health. Pay attention to Pharmacy Podcast Network content in covering the Assembia event. If you are at Assembia, please schedule time with myself and Kevin Jones, who's helping me to coordinate interviews. This is going to be one of our biggest events ever. We had a record-setting event at APHA 2024, and now this is our next conference after APHA, Assembia 2024, and it's going to be even bigger in content development as well as content push and the voice of our pharmacist professionals leading healthcare. This is important. Hey, I want to talk about Pharmacy Podcast Network publication partners. One of our favorites is the podcast by Pharmacists United for Truth and Transparency. Their latest episode is called Taking Charge, the Independent Pharmacy Healthcare Initiative, where we listen to Monique Whitney host a serious discussion with PUT board president Deborah Kevney, founder of Waypoint Pharmacy Insurance Group, in partnership with Ben Coakley. The Coakley family have been part of the pharmacy ecosystem for years, I think over 40 years, when Mr. Coakley started that. And they're helping independent pharmacies build their own insurance programs with all of the attention that you have and all the trust that you have with your clients and your patients and your communities. Guess who they trust? They trust you. Number one, sometimes number one surveyed, people trust their pharmacist. for a reason. So take a listen to that. Take a listen to Taking Charge, the Independent Pharmacy Healthcare Revolution, and how you can leverage insurance brokers to partner with you. Insurance brokers who actually know what the heck pharmacy is and how pharmacists are working with their communities in controlling disease states as well as chronic conditions. Shout out to the pain guy, hashtag pain guy. That is a trademark, by the way, by Dr. Garofoli. He is a professor of pharmacy at WVU School of Pharmacy. He's been one of our podcasters for several years. His latest podcast is called The National Opioid Settlement Beyond the $45 billion. Wow. Imagine getting 0.0001% of $1 billion, $45 billion. You got to put your pinky up to the side of your mouth when you say million, billion, like Dr. Evil. If you don't know that movie, that means that, once again, I'm getting old. But look it up. It's funny. It's a meme. So Mark goes into discussing how the $45 billion approximately, of course, and those numbers around concrete efforts and responsibilities that the National Opioid Settlement came out with. And he digs into the financials, the controlled substances that are mentioned, as well as the specific red flags within this settlement. Is it really helping? Is it going to the people that it should be going to, that caused the damage, all of the people's lives that were lost, people that are still suffering till today? Where is that $45 billion going? So take a listen to Mark's latest podcast. Dr. Nadia Archambault is the Sex PharmD. She's talking hormones, periods, and womb healing with Kim Billick. And this is a really interesting episode. And our women of this network, women of pharmacy doctors leading pharmacy in our profession. 62% of our pharmacists are female, are women leading healthcare. This is an exciting episode to talk about. How does sex health, how does that affect your patients? Do patients come to you with sexual health questions? Are there instances or more complex issues that we can put you on a show, on a podcast with Dr. Archambault to really dig into those conditions? Is there supplements? Is there topicals? Is there some kind of product that's making a difference in the lives of your patients and their sexual health, both men and women? Reach out to @PharmacyPodcast on Instagram, or Pharmacy Podcast Network on LinkedIn, or of course my LinkedIn as well. Or if you're on Twitter, @Pharmacy Podcast. And we even have a TikTok page. And how long is TikTok going to be around? That should be a podcast in itself. Why is TikTok being sought after by our government when they say that it is a national security threat? And I don't believe them. I don't believe them with as much information that goes in and out of our federal government, when so many loose ends and different secrets coming out. But we're talking pharmacy today. Hey, I got an opportunity to talk with a Robert Sunderlis, who is a writer for Medica Life, and he is all about creating meaningful leadership partnerships with and through artificial intelligence. And it's really an interesting article on Medica Life. I want you to take a look at that. Once again, Medica Life is Medica, MEDIKA.life. Once again, medica.life. Excellent article. I'm interested in seeing Robert launch his own podcast and being able to build out more content for leaders who are concerned with their organizations and how our technology, how the advancement of big data, digital therapeutics, and of course, artificial intelligence is going to affect public health. Today, we have two amazing interviews, something very special. Pharmacy 50 winner, Sami, is going to be referenced and honored today. Her daughter is going to be here with us. This is a very, very special episode that we're going to dive into. And then we're going to get into the healthcare awareness project, and really diving down into how you as an adult understand how your healthcare affects you. And do you understand how to navigate it? Do you understand how to ask the right questions? Do our children know how to ask the right questions to their providers in order to extract the best outcomes for themselves? Because all of us, your healthcare is your personal accountability and responsibility, and it's up to you to fight for your own healthcare. So we want to dive into this discussion today, and with that, we're going to start off. And if you have any questions, you have any comments for this week in pharmacy or for Pharmacy Podcast Network, please let us know. But let's get going. April is Sexually Transmitted Disease (STD) Awareness Month, a time to raise awareness about STDs, their impact on lives, and the importance of STD testing and treatment. The Center for Disease Control and Prevention also marks its own STI Awareness Week in April with the theme, and it's called the Talk, Test, and Treat. Today's podcast, we're bringing a guest, Dr. Zubila Shafiq, to the microphone. I'm so excited to welcome you, Zubila, to the Pharmacy Podcast Network.
Thank you. I'm so excited to be here, and I'm very grateful to be here.
Well, I am honored to have you. And I just want to kick off this podcast by taking a pause on our theme today, which is pharmacists tapping into more knowledge and more support of each other, support of our physicians, support of our nurses. Our nurses are awesome around STDs. But before we get into that, we want to take a pause and talk about your mother, who's one of my heroes and one of the 50 most influential pharmacists and pharmacy professionals in the nation. Sami Shafiq, Dr. Shafiq, is remembered as a resilient mother of three who overcame the challenges and graduated from NSU in 1996. And she continued her 27 career, leaving a significant mark in home medical supply and her work around Broward Hospital in the district, as well as her work with Walgreens. A shout out to Walgreens and all the wonderful work that you're doing. And then also GSK, who she also worked for. But what was it like to realize that your mother was one of the 50 most influential people in pharmacy for 2023?
Yeah, it was amazing. It's hard to think of the words, but really beautiful and memorable and very, very meaningful for myself and my family. My mother did pass away, unfortunately, last year, April of last year. And so really just seeing that so many people voted and that she really truly left a positive legacy behind and that was validated with this is just what anybody would hope for with their loved ones, especially somebody who's passed away. And so it was really meaningful, and I am so grateful to everybody who voted and everybody who's reached out. Since she has passed, so many people have reached out, so many of her past students, her coworkers, and it means a lot. So please continue to reach out.
That's awesome. You know, there's a line in Spider-Man. It's one of my most favorite movies that says, with great power comes great responsibility.
Yes.
So when I change those words, when I think of the influence and the exposure that our publication is building. We're reaching 1/3 of all pharmacists in the entire country are listening to our shows that are developed by pharmacists just like you about different subjects. And your mother is part of that legacy for the rest of eternity because of the mark that she's made. So that's what I want to kind of shift to, is that legacy leading us to action. So you and I have work to do. Um, your
Absolutely.
mother's laid to rest, God rest her soul, but she set a bar for us in order to do things in medicine and healthcare. And that's why I want to bring up HIV and STD Awareness Month and some of your experience in that, and being surrounded by people like your mother, other providers that you've worked with. You're also involved with the VA, helping some of our most fragile veterans that are geriatric based and seniors and they need extra kind of like love and help and care. So let's start with STDs. Talk to me about the state of sexually transmitted diseases and the treatment and the sometimes the gap between the public knows what's going on and the fact that they probably don't reach out to their pharmacist enough, which they could be. So talk to us a little bit about that.
Yeah, absolutely. And as a disclaimer, I am not an HIV specialist pharmacist, so there are much smarter people out there like my mother. I would just text her and be like, "Hey, what's the" So, but what I think, and just seeing this from different points of view, as a clinician, but also seeing people personally, is that I think the most important thing is access to care, and pharmacists are so pertinent in that they are frontline workers. Essentially, oftentimes they are the first person that somebody will go to, and I think that was so evident during COVID. But to me, access of care applies to so many different populations of people, and one of the things that I was very lucky to see early on, before I even got into pharmacy school, was the different roles and impacts that pharmacists can have, and really how she sat down with patients with so much compassion and lack of judgment, and really thought about what are the things going on in your life that are going to be an obstacle or a barrier for you to get what you need. So here's what you need, first of all, and then how do we get you what you need? And is this going to be the best option for you? And I got to see that very early on. And this was back in the 2000s, and you the people that are older than me even know all of the story of AZT and how that went on to different things. And then when I was in school and doing rotations, we had ALLL. So just what a journey HIV therapy has taken, and just seeing her role in that, how she would advocate and really work on getting access to the treatment that's needed, and testing and doing so much advocacy work out there, being on radio stations, doing 5K walks, going to patients' art shows to support them, really just putting putting it really out there that she is there for them as a human being, not as an HIV patient.
Yep.
And so I think access is the big thing, and continually finding these ways that maybe you can't go to the clinic, maybe you're scared about going to a clinic, but there are other methods out there, and just really educating on all of that.
So Michelle Sherman, who is our lead pharmacist on the Pharmacy Podcast Network, she has a show that she talks about the struggles of people dealing with HIV, not only from a treatment perspective, but from a stigma perspective. How
Absolutely.
the stigma is keeping us from being medication adherence driven, following up, feeling embarrassed, not having transportation, not having um, even food insecurities, how that affects people that are dealing with
Absolutely. And the cultural
HIV.
components to it. And that was one of the things that, being in South Florida at the time where she was in one of her positions, it was when West Palm, Broward, and Dade were the top three counties for HIV and AIDS. And so she didn't only see like a white male gay patient, right? She saw a large population of very different people and different patients. And I think that's something we need to remember too, is healthcare equity amongst all of the different people that are impacted, and really making sure that if you are a Black female, that you also know about what's available to you. It's not just for what you might see on a TV commercial.
Yep.
And she really was able to reach out to all the different populations, which I think was really good.
So where did the interest come in this for your mother? Was it something that she experienced as a pharmacist, or was it as an experience as a friend or as a mother, or where did that passion come from?
Yeah, she when she graduated pharmacy school, she was just always sort of top of her class and had several job offers when she graduated. And so she went, I think, initially to this home infusion place. And so she got a little bit of introduction to HIV at that point, moved on to some more whole health. And that's where she really started to seeing this introduction to HIV and infusion therapy and the patients, which where I think she really was immersed more was when she worked with North Broward Hospital District Comprehensive Care and worked in this interdisciplinary team and just became so engulfed in it and passionate about it from the get-go. And I got to see this growing up. I got to see her, you know, just have joy when she thought about her patients and how she was able to get viral levels down and get them the medication they needed. So she had Ryan White funding. So she worked with, again, coming up with a therapeutic plan once they got like genotype and phenotype, working with the physicians, getting the prescriptions. So she was doing MTM and interdisciplinary care way back when, and then working on the advocacy part of it and really getting the access. So she would also work with local community pharmacies, the manufacturer patient assistance programs, and all of that. And so, I mean, she got in, I want to say this would have been like late 19, pretty much from when she graduated. She had some exposure to HIV, but then really quickly just went into it because she was so passionate about it. I think it was really the connection that she found with her patients and being able to make a very real difference in their lives. And people saying to her, like, you're my guardian angel, Sami, you're my angel. And that, of course, it's, you know, that's very meaningful when people tell you that.
Very much so. So access to care. Let's talk about testing. There are STIs that haven't been detected, and that in itself can obviously cause issues. So let's talk about testing from a pharmacist perspective. I know that our community pharmacists are listening. We have long-term care pharmacists that are listening. That's closer to your world and caring for our fragile seniors. We also are talking about rare diseases and comorbidity, where you're dealing with maybe an STI and something else that's a chronic condition. So we know that access to care is an issue, but can you kind of touch on challenges around testing too?
I would say, again, I'm not the expert in this,
Yeah.
so I don't want to overspeak, but I think it comes down to health equity. And again, in that we need to make it as easy as possible for our patients to get, for everybody to get what they need. And that is such a big view. It's not just the test, it's how do they get there? What's the transportation setup they have? Where do they live? Do they have 3 jobs and they can't take any time off to go get the testing? Do they have the childcare they need to
Yep.
get the testing? I think it's just such a big issue and you can't really answer it without looking at all of those different things. So what is our support system where we are, and how can we as pharmacists, as patient advocates, help push that along and get those conversations going, but also remember that it's very easy for me to sit there and just say, well, why don't you just go get tested,
Yep.
when I don't know the full picture. And so I think we just need to constantly be cognizant of what is the full psychosocial picture of this person,
Yep.
and then how can I help you? Is that by making some phone calls for you or connecting you to our social worker so we can get you the things that you need. So I think a lot of it comes down to us as pharmacists being advocates and then knowing where to pull in our resources and our teammates. Like our social workers are amazing. So they know everything.
The resources, but getting those resources for our patients, that's so important, and demystifying it, letting them know that you're just as important as a patient dealing with an STI or an STD as someone who's dealing with hypertension or diabetes or drug addiction or something like that. There are more than 2.5 million cases of chlamydia, gonorrhea, and syphilis that were reported in the United States in 2022. And that's pretty serious. So that comes down out of the 330 million people that live in the United States, and there's only 300,000 active pharmacists in the United States, that shows the demand for pharmacists as advocates for public health to be that point of resource. So we're not expecting, just like you kept saying, hey, I'm not the STD expert, I'm not the HIV expert, but guess what you are? You're a pharmacist that could connect somebody to an answer. You could say, listen, I don't know the dosing of this, or I can't know exactly how to titrate that, but I know how to get you connected to other organizations, other pharmacists, other physicians, or like you were saying, like other people that are in counseling to get additional help or additional resources.
Absolutely. And I think with a lot of what you just said, probably a good portion of those are on college campuses in a certain population. And so really, again, looking at where we can put that advocacy and that education there, and what that might look like is mobile clinics and things like that. And so there are people doing those things out there, but it's getting, I might not know the answer, but as a healthcare provider, I'm going to help get the answer so that you can ultimately get what you need.
Yep. 68 million infections in 2018. Half of the new STIs were among the youth aged between 15 years and 24 years in the United States. New STIs are totaling the country $16 billion in direct medical costs, which once again comes back to testing, comes back to treatment as quickly as possible, comes back to being able to trust a where to go to get the answers. So when I think of thanking our pharmacists that are out there who do concentrate on this, I want to shout out to you and say thank you for the prevention, thank you for the education, thank you for the treatment. We want to extend the topic of STD, HIV. Maybe I'd like to introduce you to Michelle Sherman and running and her podcast. I actually sent you a link to it. It's the Conscious Pharmacist podcast, which is just a wonderful podcast that she's done. She's been part of our network for more than 6 or 7 years now, maybe 8 years. It's time goes by too fast, but
Yeah, everything I've heard about her is amazing. So I that's wonderful. I mean, she's out there doing the work.
she is.
Yeah.
So I want to just thank you for recognizing your mother's work. I want to congratulate once again Sami Shafiq as the winner of the 50 most influential people in our profession for 2023. And like I said, here's the baton, Zubila. It's it's being handed to you, and you don't necessarily have to go in the exact path, because I think of my dad's path. He was an electrician. I do nothing about electricity. I get everybody shocked. But he was a good father, and he set, he said, my word is my bond. And I followed things that my father has put in step. Whereas your mother is a little bit more parallel to your career and to your the way that you make your income and your life and what you're actually building, and how we're very thankful to you to be part of STI Awareness Week and Awareness Month for the month of April. And just want to say thank you so much for being part of this today.
Absolutely. Thank you for raising awareness about everything, about STIs and about my mom and about pharmacists, and just always advocating and giving a platform for people to speak up about things that we may not know about until we hear about it, and then we can be better.
If you want to read about the awards, if you're listening right now, just go to pharmacy50.us. Once again, that's pharmacy50.us. And if you'd like to work with our publication on a special program around STIs, around STDs, around HIV, around transgender care, around violence in the home, around something that you see sticking out as a pharmacist, as a technician, that you don't think's getting enough attention, that's the purpose for this platform, is to bring people together, our subject matter experts, to really talk more about it. It's easy to consume a podcast as you're driving or you're walking or you're doing something that it'd just be easy to consume information. Zubila, promise me that you'll come back to the pharmacy podcast and do something else, and we'll dig in, and maybe we'll talk about caring for our vets. My dad's a vet, so I think it's very personable. And today's episode is brought to you by the U.S. Pharmy, which is a T-shirt that's designed just for our pharmacists and pharmacy technicians are out there that are aware of the special needs of our veterans. But I wanted to just say thank you for being a part of this, and we hope you'll come back.
Absolutely. Anytime. So I appreciate it. Thank you guys so much.
Thank you. Wow, that was special. I want to just shout out to the family of how much stress that they've been through with the loss of their mother. Sami is a very special, very influential pharmacist, even after passing away. Pharmacy 50, the number 3 most influential pharmacist in pharmacy professional in 2023. Hey, I want to give a shout out to our sponsors today, because they keep this program going. And with that, I want to say thank you. Happier at Home.
This is Debbie Marcello, host of the Happier at Home PRN podcast. Did you ever consider all of the potential cash revenue that you're giving away? This is Debbie Marcello, host of the Happier at Home PRN podcast. Did you ever consider all of the potential cash revenue that you're giving away? What if you were to learn about services and products that you could keep in-house as opposed to referring your customers out? On my podcast, Happier at Home PRN, learn from the experts who have expanded their services to increase revenue. This is Debbie Marcello, host of the Happier at Home PRN podcast. Did you ever consider all of the potential cash revenue that you're giving away? What if you were to learn about services and products that you could keep in-house as opposed to referring your customers out? On my podcast, Happier at Home PRN, learn from the experts who have expanded their services to increase revenue, earn out-of-pocket payments, all while increasing the quality of care in their community. Listen to our past podcasts and join us for future episodes where we focus on growing your pharmacy into a thriving business. And we're not talking about keeping your head above water. We're talking about wealth and the survival of your pharmacy.
And in 3, 2, 1. Hey, when I think of my high school years, it's quite some time ago. I'm starting to get up there in my age. I think of, have we spent enough time teaching our our kids? I'd say right around the ninth grade level. Are we teaching them about checkbook balancing? Now, when I say the word checkbook, it should flag you all listening out there, especially you young people. But if you're Generation X and baby boomer, you definitely know what that is. But even from a digital perspective, are we teaching that ninth grade, 10th grade, 11th grade, 12th grade? Are we teaching them how to financial manage their lives? Are we spending enough time with them? And everybody probably is thinking maybe that happens at home, but sometimes it doesn't. Are we teaching them to understand basic structure of communications? We're getting so much into texting. We're getting so much into emailing and electronic communications that we've forgotten the art of speaking on the phone to each other and being cordial and being polite, but getting something done. And we certainly haven't taken the time to teach our children about healthcare and about having to navigate the world of healthcare. I am so excited to bring two people that I'm just pleased and honored to have on our show, Pharmacy Podcast Network, from our partners at Finn Partners. Thank you. A shout out to Colin just for bringing us this episode. But I want to introduce Lauren and Stacey, leading the organization called the Healthcare Navigation Project. Lauren, welcome to the show.
Thank you very much. I'm very excited to be here today.
Stacey, my favorite provider in the world, our pharmacists, Dr. Stacey Follman, welcome to the show.
Thank you. Thank you for having me. I'm excited to be here.
All right, I'm kicking it off to Lauren. Lauren, I want you to tell our listeners how important, like I was saying in our preface, getting our future prepared and understanding, as well as just people in general. You know, I've been in pharmacy now. This is my 20th year, not only in healthcare, but specifically in pharmacy. And it took me probably 6-7 years to really understand healthcare insurance, PBMs, understanding how to navigate things. Talk to me about the mission that you've built and how important the Healthcare Navigation Project is.
Yes. So I basically, I say I created something that never existed before, grassroots public healthcare education. That's really if you want to say it in a nutshell, right? But it's a method that I created or invented that really works. In my mind, if we're going to, since we're on the Pharmacy Podcast Network, let's just stick with pharmacy. I say, and I go on record to say, did you know that your pharmacist is the doctor of your medication, right? That you have a medical doctor who's an MD and they're a doctor of diagnosis, but your pharmacist is a PharmD and they are a doctor of your medication. So if you have a question about medication, calling your physician is not going to help you because that physician's just going to call your pharmacist.
Yep.
So, right? And the other thing is they're free. So when we look at our underserved communities or people that just don't have insurance or don't know how to get insurance, they can go to their local pharmacist. If you're traveling, if you're overseas and you don't, or I don't know, another state and you have no clue if you're sick where you should go, your pharmacist will know. Yep. So understanding all of that. So I put this program together so that people would understand how to actually self-advocate. The CDC in 2020 changed the definition of healthy people for 2030, and they include in the definition of what health literacy is, the word use, the ability to find, understand, and use your healthcare. So this program solves that problem so that you know how to use it.
It's incredible. What a great beginning. And you have the tingles on my shoulders already happening, because anybody that talks about the importance of pharmacists, you rise to the top in my mind, because, and here's the reason, not just because you're pharmacists. And I know that you probably feel like I'm putting you on a pedestal, Stacey, but it's for outcomes reasoning that I've witnessed. I've soaked in data. Every time we get a pharmacist involved in a polypharmacy situation where cascade prescribing has gone crazy and we got a senior on 18 medications and the pharmacist consultant is like, time out. And then all of a sudden, 6 months later, they're on 8 medications, and they're taking the right the right vitamins, the right supplements, because the pharmacist dialed in, and now they feel better, they're living better, and it's less expensive. And I'm like, all right, this isn't rocket science. So, Stacey, plugging the power, the hub of healthcare, our pharmacists and pharmacies and our technicians into a healthcare navigation project. Talk to us about this organization from your perspective.
Yes, so that's exactly everything you just said, Todd, is exactly why I support Lauren and the Healthcare Navigation Project. Essentially, Lauren's program shares that the pharmacist helps the patients to find accessible healthcare. So you know, everywhere in the globe, you know, the pharmacist is available to help patients and people learn how to use their healthcare. And they learn how, and they help patients to learn how to use their medication, to how to manage their medication, how to pay for their medication. That is what this program supports, helping people to be able to contact their pharmacist and be able to use their medication.
That's incredible. And you know what? That sounds simple, but you and I and everyone on this, the three of us, we know how complex this is. I just posted this morning on social media a story from a pharmacy owner in Pittsburgh, Pennsylvania, Dr. Kyle McCormick, who started a pharmacy that has nothing to do with insurance. It's all cost plus driven. And he's an advocate for all of his patients. And he's fighting against the big insurance companies to get them to release prescription information and payment information so that he can take care of his patient. And they're holding it hostage because they want the business. 6 days has gone by, and he's still waiting for a response from UPMC Chartwell, where they are holding hostage care for the patient that's desperately needing it, which, by the way, it has nothing to do with insurance from Kyle's perspective. So if we would have taught those people, let's get away from Kyle for a second. And if we would have went to a senior center or a high school or some kind of community center and gathered 20 people, 30 people together and have a chart board or have a presentation and say, here's how to navigate your healthcare. Here's how to be better stewards and better consumers of healthcare. So, Lauren, I kind of want to take it back to you and think, how do we set up dominoes where today's podcast presses one and we spread throughout virally through LinkedIn, through social media? What can we tell pharmacists that are listening right now? Where should they be? Who should they be getting? Whose attention should they be getting to really spread the message of the Healthcare Navigation Project?
Well, I believe, we didn't really talk about the actual module of the pharmacy one. And what we learn in there, we teach everyone, there's all kinds of different pharmacists. There's your neighborhood pharmacist, which is CVS, which is like the largest in the world.
Yep.
And then there's your independent pharmacies, which I don't know if I'm allowed to say that. They're my most special favorite people. Shop small. They're usually typically.
I'll whisper. They're my favorite ones too.
Really, I can't help it. And that's usually what I tell people: when you travel, find who the local pharmacist is.
Right.
Because they typically they're clinical pharmacists, they know everything. Some of them are compound pharmacists as well. Yep. But we learned what a pharmacist is, because people think that they just fill pill bottles.
Yep.
My 84-year-old mother, who worked for Aetna a million years ago, so she knows everything about health insurance, right? I finally got her to call her pharmacist. 3 years I worked on it. I said, Mom, I have a nonprofit, and people come to me but you're not doing this. Why aren't you doing this? You don't understand. I think you have side effects to your medication, but you've never called or know who this person is. So she called finally, and she calls me back, and she's like, Lauren, with this sing-songy voice, she goes, I did what you asked, and I called the pharmacist, and I asked all the questions that you wrote down for me. And then I apologized to her for taking up her time, but you asked me to do this. And you know what she told me? And I said, no, but of course I did. And she said, that this was the best part of her week, that the last thing she wants to do is spend her day filling pill bottles. And she thanked me. So that to me was like, it works. So that's I'm done now.
No, I want to say something. So, Stacey, you have a powerful position right now because you have so much information from your experiences. You know, there's good and bad in everything that I've experienced in healthcare. There's the joy and the beauty of the hearts of our providers that want to help people. And that's the basis of our pharmacists, all pharmacists in retail chains, specialty rare disease, long-term care, our independent owners. Then there's I'm not going to say the bad, but there's the negative side where it's the bureaucracy and the policy and the insurance and things that just don't make sense, where the money that is there through taxpayer dollars or private paying dollars is not getting to the end user. It's not getting to the consumer. Part of this ecosystem is the world of the pharmaceutical manufacturer. And once again, we've seen stories where the pharma manufacturer has put in billions of dollars into helping people with rebates and different things are working. And then you see the ugly side of it, where we find out that it's over profiting and not getting people their medication and holding it back. And that's just being human beings, because I've done things wrong in my life and I've done good things in my life. But Stacey, there's a power here that you bring, and that is this deep 25 plus year experience of understanding the inside of how a pharmaceutical manufacturer ties into this ecosystem, and how your knowledge now of that background ecosystem of how that works now ties into teaching our consumers, how do we use our healthcare better? So go into that for our.
Yeah. So I'm glad you brought this up. So I think what's very unique about the Healthcare Navigation Project is that we are teaching the people with the right questions. First of all, the fact that they can ask, they're empowered to ask a question to their pharmacist, like, I don't have insurance. How am I going to get this medication? What happens if I, travel from place to place? How do I get my medication? I don't even know the right questions to ask my doctor about my medication. My insurance says it's not covered. What does that mean? And how can we get around that? Do you have any coupons? So this program empowers all people to figure out the right questions to ask, and to understand that your pharmacist is the most accessible person who can answer those questions in a way that can help you, ultimately leading to better patient outcomes, which is what better patient outcomes, because the patient will actually receive the medication and they will commit to taking the medication, and then they will obviously get better. So this program really empowers those people to have the opportunity to ask their pharmacist these questions, and then to obviously get access to their medicine.
Am I allowed to interject something?
Of course.
So I don't think that we mentioned one of the biggest differences of our program is we make live phone calls. We take the scariness away from people so they understand that people are just people. Your pharmacist included, that your pharmacist is there to help you, that they're not a barrier. You shouldn't be afraid, oh, they're the pharmacist, I can't ask a question, or, whatever it is. And we also believe that we have cures for rare diseases within our communities. And what better person to be out there sharing knowledge and empowering people than their pharmacists? The pharmacists can go out and say, I'm free. We actually, right, Stacey, we spoke with an independent pharmacist in our module last week. And one of the students said, I think your daughter will go, whatever. He says, well, I'm not allowed to really say anything about that. But he told all the kids and I think that's the beauty about our program is I tell them things, but what does that mean? But then when we make a random phone call and the person on the other end says exactly what I'm saying, they have buy-in. Yep. So I guess the whole program is based on buy-in. So if your pharmacist it should be the center of your community, in my mind, then they should be the ones that people have the buy-in for. So rather than, wasting money and going to the ER, which we know used to be a thing and isn't anymore, then understanding you can go to your local pharmacist, they can share coupons with you. They can call. I mean, my husband was out of work at one point and my son's medication went to like $500 a pill. And she worked out this thing where they could backdate and they were holding like all these different things that they can do for you because they care. And people don't realize that they're not just this person over there where you don't even know what they're doing because other people are in front of them. Okay, so I'll be quiet.
Oh, it's like healthcare jujitsu. It's
Yeah.
a pharmacist
Yes.
knows exactly how to bend and to manipulate and move, and because they're the advocate for the patient and they want to be the advocate for the patient. And the reason is they know pharmacologically how this medication over a period of time is going to impact you, A. B, they know if over that same period of time they see things happening to you that aren't quite right, they can make suggestions to the quarterback of healthcare, which is our physicians, and saying, we have to change this medication because this patient is not reacting the way that it was intended. Physicians don't know that. The physicians relying on their superstar running backs and their superstar defenders and their superstar wide receiver. I know I love football, but I'm just saying you have to have a team of people that are involved, but we have to have the intelligent, understanding patient, consumer to know what do I have to ask? What should I know in taking responsibility for my own health care? And it starts in our youth. And there was a statistic that is on your website that kind of shocked me. And it said that 85% of our youth don't have any idea how to access their health care, or they don't understand how health care works. Stacey, talk to us about that statistic specifically and what your organization is doing to change that.
Yeah, this is actually, Lauren and I have talked about this openly, that before I became a part of the Healthcare Navigation Project, I really didn't have this, I didn't understand this concept. Now, having talked to high schoolers, in person, live, and teaching them and training them, I really understand that they have and even my own daughter, who I shared with her some questions to ask her physician, and then she came out of the office and I asked her, did you ask the physician these questions that I told you about? And she said, no, the doctor should have asked me questions. They're the doctor. So even my own child, I've had this experience with. They don't feel empowered to use their voice, and they don't even know the right questions to ask. And that's the excellence of this program, is that we teach them how to talk to healthcare professionals and the fact that they can before they need to use it. So that's another thing. We teach them before they're in that emergency setting or before they even need to walk into their pharmacy. Now they're off at college and they have to go get a prescription because mom's not going to pick it up or dad's not going to pick it up. And they don't even know they don't even know what to do. They don't even know how to approach the counter, So that's what this program teaches them how to talk to somebody, how to establish a relationship, and the answers that in this case, a pharmacist can provide to them.
Excellent. I think of, like I said in the opening, your finances, changing a tire, because who took the time to teach a young 16, 17, 18-year-old driver how to change a tire? Sexual health, who's talking about that? Where are they going? Using your insurance, how do you use insurance? How do you protect yourself? How do you advocate for yourself? How do politics, understanding branches of government, how to leverage. I mean, there's so much that we think of our school systems, and sometimes we're so busy as parents. I have 4 daughters, so I understand this. I go to work. By the time I get home, I'm exhausted. There's some cleaning up to do or some chore to happen. Am I sitting down with my daughter? My youngest daughter's 12, and am I saying, "Hey, do you know how to reach out to your teacher, or do you know how to reach out to mommy or daddy or your aunt or uncle that you trust and talk about something in any of the variances that we touched, just to protect them, to empower them, so that when something happens, just like getting into a car accident, what are the steps if I'm in a car accident that I have to take to make sure that everything is okay? Safety of getting off the road. If you got into an accident on a busy road, get the heck off of the road. Don't stay in your car. Don't stand beside your car near the traffic. Get off, get behind a guardrail or do something to keep yourself safe. This is the same thing. This is teaching our youth and teaching people early 20s, even people in their 30s. They're very confused about the complexities of healthcare, and the navigation project is there, and it's a beacon, and it's there to do nothing but tell our consumers about the world of our health and navigation of our health. Talk to us, Lauren, about the resources that you've set up on your website. I'm going to have show notes, but the website is thehealthcarenavigationproject.org. Once again, is the the healthcare navigationproject.org. But talk to us about the resources.
So currently we have 5 modules that are running, but coincidentally, I do have one on financial literacy because I was a banker, so I can certainly do that piece, right? And gender equality. We have not put those out yet. Full disclosure, but they are in the copyright and will be in the patent. So right now we have the 5 principles of self-advocacy, and those are really everything is about that people are just people. But we don't just say that, we explain it, we show them what that means. All people. Every time I'm in a cab, I ask them if they have insurance. I tell them what I do. And then we call 211 together, and I get them talking to somebody that can help them. They are just overwhelmed with excitement when it's like Cash Cab, but for this, right? So how much time do we have when we call? One time we didn't have time. 2 months later, I get a phone call through my website, and it's the man, and he says, I don't know if you remember me, but I was in your cab in New Orleans, and you told me if I ever had any questions that I should call you. He says, I just came from the dentist and started in this whole thing, and I realized that he was in Medicaid, and COVID was over, and they were supposed to re-up in October, and he didn't get that memo. So we put him in touch with somebody, and he was just, I can't, people don't realize that there's so many people that want to understand this and don't believe they're even allowed to, or even know the first place to look. So in my opinion, if your pharmacist is in the plan, they can be they touch pretty much every person somewhere, right? At some point you need medication. So our program teaches you 5 basic principles of self-advocacy. Then we do your mental health toolbox, basic healthcare navigation, where we call physicians, and then our Let's Talk Pharmacy, which is our favorite one, and then specialty healthcare, where we teach people how to find specialists, how to research for them, because as you know, your doctor gives you a printout of like every doctor in the universe because of HIPAA. We teach people those words like HIPAA and elevate and all these words that you could just throw out to make pretend that you know what you're saying so people will talk to you. And then we do a whole module on hospital care and the future of healthcare, how to get around the bucket system and all of that. But in the hospital segment, we speak with the social worker, we speak with the inpatient clinical pharmacist, and I tell this story about how somebody is a true story about a person who defended somebody's honor, whatever that means, ended up with their jaw wired shut, and told the doctors that he was fine, which he wasn't, and so he's leaving, and realizes now that he's on the bench outside that they've given him pills and he can't take a pill because his jaw's wired shut.
Oh,
And
no.
what do? And who can help you? Well, guess what? The clinical pharmacist can walk out the door and help you. You can call them. People don't realize how amazing a clinical pharmacist or pharmacists are. They can talk to you about all the medications you've been on, what might interfere with what, all these things that people have no clue about. So that's what our program is, to teach people to be unafraid. And that the resource is their pharmacists. Most are open 24 hours and they're free. So if you don't have insurance, it doesn't matter. So that's what we and then we do have a whole resource page that talks about all these other resources. You might want to be able to pull it up. There's, companies that donate planes and pilots to fly you to your treatments. If you, let's say you were able to get the treatment you needed, but the the wherever you are isn't going to give it to you, you can call on them and they'll fly you for free to your treatments, or if family needs to visit you, under the resources.
The program is teaching that, there are nonprofits that like the Healthcare Navigation Project. There are other nonprofits also that people can go to help with assist with their healthcare or other potential needs.
Oh, yeah. So that's step therapy, Safe Step Back. I go to Washington, D.C. every June with Patients Rising to advocate because my son was a victim of, they tried to make him a victim and became a victim of step therapy. So this is my life here, is making sure that this doesn't happen on my watch to anybody else if I can help it. There's also a 504 template. I know it says Crohn's, but it was designed by two attorneys, and it's like a Chinese menu of all the accommodations that you could possibly ask for, and that I tell people never give them up. Whatever you do, if you get something, you never give it up, because you will never ever get it back. So if you scroll down, you can see you can download the document, and it should give you, is it working? Yeah, it's the nature. It just has every single accommodation. And I found it really useful when my son was diagnosed, that I was able to go in with the to the school and sit down and show and have that in front of me.
Yep.
To make sure that I was getting everything I needed. But you can use it's 504. You can use it for your employer. You could use it anywhere.
It's excellent. It's such a good resource. Plus, it saves time for the pharmacist that has access to this information to say to a patient, hey, I'm going to either email you this, or I'm going to text you this, or I'm going to send you this information. It's a plan template to really help drive someone that might be dealing with Crohn's disease, for example, and it's a step-by-step form describing the disability. It's describing the processes. This is excellent. So this is.
I say there's one other thing I think is really important for people to know, and I have it on there. People think there's some magic to the number 26, that you're off your parents' insurance at 26. That's just a number. There's nothing behind it. So if there's a reason to stay on your parents' plan past age 26, this is at least the example from Anthem, the one that we use, because my son is still on his father's insurance and he's 28 now. So it can be done. You just have to advocate for yourself. And this is the form you can show whoever your insurance company is to say, what do you have that's similar? Or can we use this and take the, white out Anthem and put in whoever your insurance company is?
That's great. It's so detailed. It's a form that gives the simplicity. If you're listening on podcast, you can't see this on your screen. If you're watching us on YouTube, you actually be able to see the form. It breaks it down into the exact checkboxes that you need to fill out, the forms that you need to fill out, the information that you need, and it tells you where to send this. And of course, this one might be an example for a specific system. But this is terrific. This is the kind of information that our community pharmacists need to have access to. I'm going to put links in the show notes to the landing page for the resource section.
Thank you.
I also want to say, Stacey, what about rare disease and specialty pharmacy where it becomes a little bit more complex? Is there anything in that that differentiates advocating for yourself and understanding the processes?
Yeah, I think I'm glad you mentioned rare disease. Like Lauren, I had a son with a rare disease, and he lived to be 8 months. And I too had to navigate. He was born with a terminal genetic illness and passed away at 8 months, almost 8 months. And I too had to navigate the healthcare system, and I had to learn that on my own. And in learning that, I learned about rare disease and specialty pharmacy, and essentially, patients with rare diseases who have to get medication from specialty pharmacy have to navigate all kinds of insane um, circumstances in order to, as Lauren has shared before, to make sure that their children or themselves have access to medication. This is something that a pharmacist can help you with, and that is precisely what this program teaches: is the right questions, the fact that you can feel empowered to ask these questions, but the fact that the pharmacist is available to answer the questions to help you navigate getting your medication potentially from a specialty pharmacy. So a specialty pharmacy is not somewhere where a patient walks in and gets their medication. So
Right.
that's a unique situation for patients with rare disease who already have a unique situation. So oftentimes, you can go to your patient advocacy groups and things like that, and a pharmacist, might be available to talk to you, to walk you through those steps.
Excellent. Excellent. Well, both of you, champions of our consumers, champions of the patient. Thank you so much for sharing this with our listeners. This is an action opportunity. This is the first of many engagements that I want to have with you, Lauren, and with you, Stacey. I'm going to connect you with other podcasters that are connected to our network so that we can really expand upon this. We have pediatric focused pharmacists, people that are focused on maternal health, sexual health, long-term care, and our seniors, our fragile seniors, as well as institutional people that are dealing. This spreads out through their entire network. There isn't one show or one theme that we touch that this can't fold into and connect into. So this is very special. I want to say thank you to Stacey for being here and sharing with us. And Lauren, you are a champion and a maverick. So thank you so much for talking to us today about the Healthcare Navigation Project.
Thank you for letting us spread the word. That's all you want to do in nonprofit is spread the word and help people.
Absolutely. If you're listening to this podcast, we ask that you share this on social media. Please tag Pharmacy Podcast so that we can actually retag and reshare the content over and over again. If you're on LinkedIn, please connect with Stacey and connect with Lauren. I will have their LinkedIn profiles. I've already found them in our show notes so that you can have quick access to reaching out to them so that we can network. Our network is strengthening and pharmacists are leading healthcare. So thank you for all that you do, pharmacists, that you're out there. We know how frustrated you probably are for your patients as advocates of healthcare. And keep going and reach out to us. We'll get you connected with the Healthcare Navigation Project if you'd like. And thank you so much for listening to the Pharmacy Podcast.
Thank you.
That was awesome. Thank you so much to the team that got a hold of us from the Finn Partners Group and really got us an opportunity to interview Lauren. That was really, really cool. So, hey, right before we go, I'm just adding a quick hit in because this came up as I was listening in with the interviewing on this latest episode. But there is a new study that confirms community pharmacies can help people quit smoking. So this is a Newswise article that's from newswise.com. And it says a study confirms community pharmacies can help people quit smoking. The findings came out in the article Closing the Tobacco Treatment Gap, published in the 10th anniversary special issue of Pharmacy. The results provide valuable insights into the implementation of tobacco cessation services with community pharmacies while identifying barriers to further improvements. So this is no new news to our community pharmacies who have been helping for years to get people to quit smoking. But listen to what I am telling you out of love. You need to brand this in your community pharmacy, in your long-term care pharmacy. You need to find the funding and the grant money that's there in your states to get the project assisted, maybe some of your administration fees to get it going. Okay. Give me some money and I'll promote it for you. And we'll, get into the public relations side of this. But if we prove to health plans, if we prove to insurers, if we prove to the cost plus drug rise of what's happening in community pharmacy, that pharmacists in community pharmacies can help people quit smoking, look at the metrics, look at the data of how horrid people's health it becomes as they get older and older in life and smoking more and more in life. So our smokers are having major, major problems in comparison to non-smokers. Everybody knows that. So why aren't we using this information to market you, the individual pharmacist in pharmacy? If you're interested in a marketing program that's a turnkey marketing program to put together a quit smoking campaign specific to your community, don't name it anything. You have to blend this into your community. That's part of the strategy. I'll give you that free stuff away. But hey, this has been a wonderful This Week in Pharmacy. If you want to do more, let's work together. Together RX, I always say. Together RX. That's what we're all about. And I know we're making a difference. And I thank you so much for your listenership. I thank you for your suggestions. And most of all, I thank you for being pharmacists and being dedicated to public health and better patient care. And with that, I hope you have a great week.